It's a pleasure to introduce our latest research on thulium laser enucleation of the prostate. It is worth mentioning that all procedures in our clinic were performed on novel Russian thulium laser, UROLASE. It's a fiber laser system with two wavelengths, 1 and 94 microns with max power 120 watt for surgery and 1 and 56 microns with max power 15 watt for hemostasis. We'd like to show you one of performed tulip procedures. Patient 66 years old with prostatic volume about 85 cubic centimeters. We started operation with cystoscopy and location of urethral orifices. In this case, we use energy setting 1.5 joule and power setting 60 watt. First step of operation is bladder neck incision at 6 o'clock position, in fold beginning at the bladder neck and ending just proximal to the verumentanum. This incision is carried down through the depth of adenomatosis tissue to reach circular fibers of the prostatic capsule. Before the next step and connecting of incisions at the level of verumentanum, we reduce laser power from 60 to 30 watt to avoid possible damage for sphincter and prevent postoperative incontinence. Next step is separation of the posterior portion of the lateral lobe from the capsule. We perform short incision in the left lobe and then form plane of dissection. Once the initial plane is developed under the left lobe, we continue in the proximal direction, freeing the lateral lobe from the capsule by moving the laser fiber step by step in a transversal motion using laser energy and blunt dissection by the beak of the resectoscope. We can see hemostasis is very nice and there is no need in additional coagulation. Then we perform incision at 12 o'clock position, beginning at the bladder neck and proceeding distally. This incision should span from the level of the bladder neck to the level of verumentanum. In this step, we must reconfirm the location of verumentanum by looking toward the floor. Once the incision is created, we dip it to the level of the surgical capsule along its entire extent. Thulium laser with wavelength of 1 and 94 microns is observed in 4.5 times higher than holmium laser with 2.1 microns wavelength and has a more shallow penetration depth of approximately 0.15 mm. The shallow penetration depth minimizes the coagulation zone and collateral damage to sensitive surrounding tissue for clean and precise incision. After this, we proceed under the lobe to divide remaining attachments at the floor of the capsule and the posterior bladder neck. The lobe can then be pushed into the bladder in a retrograde fashion with the beak of the resectoscope. Finished with the left lobe, we start to enucleate the right one, which is performed a similar way with a 6 o'clock incision beginning at the bladder neck level and moving distally. This begins separation of the posterior portion of the right lobe from the capsule. The plane between the right lobe and the floor of the surgical capsule is further defined by cutting laterally from the verumentanum in a transversal fashion. The bake-off resectoscope can then be used to provide leverage under the lateral load. Then we continue division of the posterior attachments to the 12 o'clock level, thus enucleating the right one. Reliable hemostasis is almost invariably achieved with the use of this technique. However, all the bleeding vessels must be coagulated even in the case of the minor bleeding. The possibilities of the thulium laser allows us to correct the plane of resection during enucleation without any difficulties, making procedures safer. This is advantage of tulip comparing to holip, where identification of the surgical capsule at the very beginning of surgery was one of the main aspects of the procedure. And the last step is marcellation of enucleated tissue. Our study included 46 patients aged 61 to 80 years who underwent tulip enosis in September 2016. The prostate volumes were between 45 and 200 cubic centimeters. Summing up our first experience, thulium laser enucleation of the prostate enables significant improvement of voiding parameters and the quality of life.